This my excavation to days cool.
All right, for the knee joint, you have, for the ligaments, you have the anterior cruciate ligament, which maintains anterior stability, and the posterior cruciate ligament, which maintains posterior stability. In addition to the ACL and PCL of the knee, you also have the lateral collateral ligament, which maintains lateral stability, and the medial collateral ligament, which maintains medial stability. Right. Also in the knee, you have your menisci, which are really important for cushioning. You have your medial meniscus and your lateral meniscus. In the knee joint, you have three bones primarily. You have your femur, and you have your tibia and your patella. Your femur articulates with your tibia via the lateral epicondyles and medial epicondyles, and it articulates with the lateral condyle of the tibia and the medial condyle of the tibia, and your patella just rests on top of the femur.
The knee joint is a ginglymus joint, also known as a hinge joint. It undergoes flexion and extension as its range of motion. Extension is going to be 180 degrees, as you see here, flat line. The quads are what cause the need to do extension. The different quad muscles that we have are the rectus femoris, right here in the middle. You have the vastus medialis on the medial side, the vastus lateralis on the lateral side coming up around here, and deep to the rectus femoris is the vastus intermedialis, denoted with the blue marker. As you see here, it's deep, so you can't typically see it. But all of these quad muscles come down, meet on the quad tendon, go over the patella to the patellar tendon, and insert at the tibial tuberosity. All of this is innervated by the femoral nerve. In addition to extension, the knee is also capable of flexion and up to 140 degrees of flexion, just like this. The muscles that allow flexion to occur are your hamstrings. Your hamstrings will all come up and originate on the ischial tuberosity, that's kind of denoted by this star here. They're all innervated by the sciatic nerve. The muscles that make up the hamstrings are the semimembranosus, which is deep to the semitendinosus. Over here we have the biceps femoris, and the synergists of the hamstrings are denoted in purple. It's the popliteus right here and the gastrocnemius right here. In addition to flexion, when the knee is in a flexed position, you can internally rotate and externally rotate. Internal rotation makes up or is capable of 30 degrees, just like this, and that is aided by the semimembranosus and the popliteus. In external rotation, it is capable of going up to 45 degrees and is aided by the biceps femoris in this action, and that is are the hamstrings.